all across the state who are joining forces today to combat hunger and food bank shortages during this crisis. One of our hardest working agency directors during this crisis is Department of Human Services Secretary Grace Ho. Secretary Ho is here today to talk about the essential role of the philanthropic community in our response to COVID-19 and in maintaining the continuity of human services. I'm also incredibly glad to have with us today one of the nation's most formidable voices for vulnerable people, families and children, who works hard for us every single day representing the state of Illinois in Washington, D.C., and that's Senator Dick Durbin. Senator Durbin, I want to thank you for all the work that you're doing to help us build a series of relief packages that actually aid working families and small businesses, and I'm really glad that you're here in person to share more about that. I'll have the pleasure of introducing our other guest in just a few moments, but first I'd like to turn it over to our Director of the Department of Public Health, Dr. Ezike, to provide a medical update on our fight against COVID-19. Doctor. Thank you.
Thank you, Governor. So I want to begin today by thanking those of you who continue to practice social distancing across the state. It may not seem like it now, but you are helping us to get to the end and eventually get to returning to our regular normal. To those that continue to be outside disregarding social distancing guidelines, I'm begging you to think of your fellow man, woman, and child. The interconnectedness between all of us is so clear, and we need our entire community to perform these important tasks, or else we suffer the consequences for all. Today, unfortunately, we are sharing 673 new cases of COVID-19, which brings our total for Illinois to 2,538 individuals. Sadly, this also includes 7 additional deaths, which brings us to 26 lives that have been lost to COVID-19. 37 counties across the state are reporting cases. Even if you happen to live in a county that does not have a case right now, you should absolutely take precautions and follow all of the same guidance as if you knew the virus was circulating in your community, because it is. Please take the same precautions and stay home as much as possible. I urge us all to not become complacent. It's the only way we're going to end this pandemic. Let's actively work together for the betterment of all. I know that as the weather warms up, we are tempted to get together and socialize, but we need to look forward and look for the big picture. There's a lot at stake, and we can't go for short-term wins at the cost of our society. Let us not grow weary in well-doing. Let's stay strong and stay the course. It's the only way we can stop the spread of COVID-19. We have to reduce the number of people who get ill. We have to reduce the number of deaths. We can end this pandemic. And now I will summarize my comments in Spanish. Buenos tardes. Me llamo Ngozi Ezike y soy la directora del Departamento de Salud Pública aquí en Illinois. Quiero comenzar hoy diciendo gracias a la gente que continúan practicando el distanciamiento social en todo el estado. Ahora no parece, pero está ayudando a acercar al normal. A los que continúan afuera, no practicando distanciamiento social, les pido que piensen en sus compatriotas de Illinois. Los está poniendo a usted y, lo más importante, a usted mismo en riesgo. Hoy reportamos 673 nuevos casos de COVID-19 aquí en Illinois. Esto incluye 7 muertos adicionales que nos lleva a 26 vidas perdidas en Illinois. 37 condados en Illinois están reportando casos. Si no hay casos reportados en su condado, todavía debes tomar precauciones, como si el virus estuviera circulando en su comunidad. Probablemente el virus está, Tome las mismas precauciones y quédase en casa tanto como sea posible. No seas complaciente. Es la única forma en que vamos a terminar con esta pandemia. Tenemos que cuidar uno al otro. Yo sé que el clima se calentará. Podemos sentir la tentación de reunirnos y juntarnos. Les pido que no lo hagan. Vamos a seguir luchando para Illinois. Es la única forma en que podemos detener la transmisión de COVID-19, reducir la cantidad de personas que se enferman y poner fin a esta pandemia. Juntos lo haremos. And with that, I would like to bring back to the podium Governor Pritzker.
Thank you, Doctor. Thank you to Dr. Ezike. Earlier today, we received word that my request to the President for a federal major disaster declaration for Illinois has been approved. This declaration will provide emergency funding to increase hospital and housing capacity as we respond to this unprecedented health crisis. This declaration also provides resources to expand telehealth, allowing us to safely reach more Illinoisans in need of care. My administration is also seeking another disaster declaration for all 102 counties of Illinois, which would allow us to access FEMA's Individual Assistance Program. This would give us resources like more unemployment benefits for those not currently eligible for state unemployment insurance, enhanced benefits for those seeking shelter, food, and emergency supplies, new legal services, and financial assistance to our underinsured households. I want to begin today by reiterating yet again how vital it is to follow the guidelines of our stay-at-home order. First, let me say that the vast majority of you have been doing exactly what I've asked and what the doctors have recommended. So thank you. You're staying at home and you're following the CDC and IDPH guidelines for staying healthy in the midst of this pandemic. But yesterday, when temperatures across Illinois went above 50 degrees, in Chicago, that meant that people were breaking out shorts and heading to the lakefront. And that happened in other places across the state as well. Throwing all caution to the wind in the midst of a deadly pandemic is not acceptable. You are putting not just yourself, but your family and your friends in danger. You're also putting strangers in danger as you come in contact with them. Sometimes it'll be a parent or a child, someone you don't know, someone's spouse or loved one. Folks, we live in a free country, and we all want to maintain our freedoms, even in the context of our stay-at-home order. But I am begging you, please, if you don't have to be out, stay inside. If you go outside, please find a place to go that is not crowded. For the sake of everyone's health, follow the social distancing guidelines that we talk about here every single day. Stay 6 feet apart and don't gather in groups of 10 or more. Right now, hosting a party, crowding down by the lake, playing a pickup basketball game in a public park. If you're doing these things, you are spitting in the face of the doctors and nurses and first responders who are risking everything so that you can survive. We are quite literally in the middle of a battle to save your life. Every day I look at the number of positive cases, of tests conducted, of deaths. I pore over hospital capacity and bed utilization and availability of ventilators and stocking of PPE and increasing the number of makeshift ICU beds around the state. My staff and I work to chase down literally every lead for personal protective equipment. And your public workers are engaged in this activity every single day, all across our state. Right this moment, emergency workers are delivering new containers of nearly 1 million units of personal protective equipment like masks and gloves to healthcare workers in Edwardsville, in Champaign, and in Peoria. And every day I ask myself, what other measures can I take to halt the spread of this virus? To be very clear, this virus doesn't care that you're bored and that you want to hang out with your friends. It doesn't care that you don't believe that it's dangerous. The virus could care less if you think that I'm overreacting. It has infected infants. It has killed people in their 20s and 30s and 40s. It has forced doctors around the world to make terrible decisions about who will live and who will die. If you get a loved one sick because you didn't stay inside, they will have to travel alone to the hospital without you by their side to comfort them and look after them, because hospitals and healthcare centers can't afford to accommodate visitors right now. I don't tell you all this just to scare you. I tell you this to save your life. We all have to own our actions right now, all of us. Ultimately, you'll be judged by what you do in this moment. And I have one job and one job only: to save as many lives as possible, to keep as many people healthy as possible until we can develop a treatment and a vaccine. So please, please follow instructions and stay at home. In addition to the health challenges that we're all facing, the economic toll of this virus has been difficult for most people to bear, but we must confront that head on as well. Since the beginning of the month, Illinois has received over 100,000 more unemployment claims than we had by this point in March of last year, 2019. Total U.S. unemployment claims this week broke the previous single-week record nearly 5 times over. We've got surveys reflecting that 1 in 5 American households have seen a reduction in work hours or a layoff, dropping 1 in 4 households below $50,000 income. And that information was collected a week ago, amid circumstances that are truly evolving by the hour. Events that once seemed unimaginable have quickly become a daily reality. But let me tell you something amazingly great about our state. Since I put out the call for retired and former healthcare workers to rejoin the healthcare workforce to staff our hospitals and our healthcare centers statewide, 450 Illinoisans have submitted applications to do just that, and more are doing so even now. Your fellow Illinoisans continue to show up for each other, no matter how hard things get. I know that because I see it happening every single day in every corner of our state. I see our young people volunteering to deliver meals to seniors, our retired healthcare workers jumping at the chance to serve once more, our Illinois manufacturers retooling to produce the goods that will keep us all safe, and our teachers finding new ways to enrich the lives of their children. I see members of the Illinois National Guard leaving their families to staff testing centers for first responders and working to help stand up mobile hospitals. I see our grassroots organizations on the ground in communities across Illinois stepping up to answer the most fundamental calling they have to do the most good for the most people possible. It is so often the case for Illinoisans, for all Americans, that during our darkest days, we live our finest hours. With that in mind, I am thrilled to announce a new initiative to support the nonprofit organizations caring for those most in need as we combat this virus. In partnership with the United Way of Illinois and the Alliance of Illinois Community Foundations, we're establishing the Illinois COVID-19 Response Fund. This fund will support local community foundations and organizations and nonprofits across the state who are doing the work that matters most to those hit hardest by COVID-19, providing emergency food and basic supplies, offering interim housing and shelter to those who need it, expanding primary health care services, assisting with utility costs and other financial burdens, and supporting children and families who are enduring school closings. Already, the Illinois COVID-19 Response Fund has raised nearly $22 million from an unprecedented founding coalition that has rallied together around the state that they call home. My team and I are incredibly grateful for all of the businesses and leaders and organizations who have stepped up to meet this moment. And of course, I want to thank the fund's chair, former United States Secretary of Commerce, longtime entrepreneur and civic leader, and most importantly, my big sister, Penny Pritzker. She has taken on this project like no one else could, and already she's catapulted it to incredible heights in just a few short days. When it came to finding someone who could lead an initiative of this magnitude, there is no one better, and I'm so proud to have her leading it. For more information on this fund and for those who can afford to make a contribution, please visit ilcovidresponsefund.org. That's ilcovidresponsefund.org. Illinois means something to all of us, and I want to be clear, no amount is too small. In the coming weeks, individuals and families in need of support should visit that same website, ilcovidresponse.org, for updates on which local organizations have received grants to offer assistance in their communities. There will be multiple rounds of funding administered by a steering committee of dedicated leaders all across this state. So revisit the site if you don't see your hometown on the list after the first grants are announced. This is a fund to support all Illinoisans. From Chicago to Carbondale, from Cairo to Rockford, no one is immune from this virus, and nobody should be left to recover without help. We will get through this if we work together and stand up for one another. So thank you all, and now I'll turn it over to the chair of the Illinois COVID-19 Relief Fund, former secretary and longtime sibling, Penny Pritzker.
Thank you, Governor Pritzker. We are so grateful to you for your outstanding and dedicated leadership at this critical time for our state and our nation. Your passion for helping others is truly inspiring, and I am so very, very proud of you. When JB called me last week to talk about the need for a fund to support basic needs for all Illinoisans during this critical time, he said there was nothing more important that we can do than to help the too many people across our great state who are desperate for assistance. That is what this effort is all about. I am honored that JB asked me to chair this endeavor that we are announcing today, a new statewide fundraising effort to quickly deploy needed and critical resources and support to our state's most vulnerable residents in the wake of this terrible pandemic. Make no mistake, these funds will help many people across our state who are really, really hurting now. Today, the Illinois COVID-19 Response Fund is pleased to announce that we have raised, and Governor, I hate to correct you, but we've raised nearly $23 million since you were last briefed. Another million came in from individuals, from corporations, and foundation donors. These funds, and with your help, hopefully much more, these monies will be dispersed to nonprofit organizations across our state, serving individuals, families, and communities hardest hit by COVID-19 pandemic. While it is me standing here today representing this effort, there are many, many others that we owe a deep appreciation for making this happen. We're particularly grateful to the United Way of Illinois and the Alliance of Illinois Community Foundations, who are working in collaboration with the Office of the Governor for helping us establish this effort and serve as the organizations that will house this effort. We also want to thank the incredible team that has worked for the last few days helping us build this effort. Led in the short term by Gretchen Sims Crosby from the University of Chicago, the Boston Consulting Group, Accenture, the Kivett Group, and so many others who have stepped up to volunteer their time and their energy on behalf of our fellow Illinoisans. I have been blown away by the so many people who have answered the call in just the last few days to create this effort. Everyone we asked to help signed on immediately, and I mean everyone, and without hesitation. And we are so grateful for their time, their expertise, their resources, and their passions at this to help us with this really deadly cause. More specifically, this fund will swiftly and efficiently deploy additional financial resources to local community foundations and nonprofits to support residents in need of emergency food and basic supplies, interim housing and shelter, primary health care services, utility and financial assistance, support for children and other vulnerable populations, and nonprofit safety and operational assistance. The Illinois COVID-19 Response Fund will work in tandem with other funds set up around the state to ensure that the resources are directed where they are needed most. In particular, we are modeled on and will work closely to complement the Chicago COVID-19 Response Fund, whose leaders have been extraordinary partners to us already. The fund will provide flexible resources to local nonprofit organizations across the state to supply essential resources to the individuals and households most impacted by the pandemic. We designed the fund to be flexible so it can deploy resources to address possible additional areas of community need as they develop. And while I'm honored again to chair this effort, we have an incredible, diverse steering committee made up of philanthropic, social sector, and corporate leaders from across Illinois who will determine where to deploy these funds. To learn more about the Illinois COVID-19 Response Fund, I urge you to visit our website at www.illinoiscovidresponsefund.org. We are grateful to all of our early funders, and we would appreciate anyone across our state who is looking to help to give to this cause. Even $1 or $5 can make a difference in the lives of others at this horrific time. While we launch this effort today, our goal is to have announcements in the coming days as to where and which organizations we will disperse the funds that we have raised. Again, the point is to get these funds out to the organizations and nonprofits as quickly as possible so that we can help our most vulnerable residents who are feeling so much pain right now. Thank you again, Governor Pritzker, and to the many organizations, individuals, businesses, and others who have joined us in supporting this effort across this incredible state and at this across this incredible state that we are blessed to call home. Let me close by saying I am personally blown away at the nearly limitless capacity and generosity throughout our state to care for others. And that gives me hope and certitude that we will come through this crisis together and stronger. And now it's my pleasure to introduce Secretary Ho. Secretary is head of the Illinois Department of Human Services.
Good afternoon. Thank you, Secretary Pritzker. I've spent my entire career in mission-driven work, and I've had the pleasure to work in the nonprofit sector, philanthropy, and of course government, as the Secretary of the Illinois Department of Human Services now. In my view and experience, we together, mission-driven organizations who are built for the public good, must work together like pieces of a puzzle to maximize our efforts, reach those most in need, and create change for good. This is a moment for us to do that. Before I left my position in philanthropy to accept this amazing position to be a part of Governor Pritzker's cabinet, my parting conversations with my philanthropic colleagues was about how in my new role we wanted to maintain our connections. We committed continuing to work together and connect our institutions. Once I began as secretary, I formed a philanthropic roundtable chaired by the Chicago Community Trust and Polk Brothers Foundation, and gathered a statewide group of foundation leaders to learn about the Department of Human Services, our state's needs, and to develop partnerships to leverage our assets across the state. We didn't know at that time that we would be called together to work on a crisis of this magnitude, but I have faith in the ties that we have developed to rise to this challenge. As a former member of the philanthropic community, I appreciate its power to convene, catalyze, inform, and inspire. This, coupled with the strong and compassionate leadership of our governor and our administration, the magnitude, the breadth, and reach of our state government, I know we can produce results together that separately would not be possible. Further, our nonprofit partners are our on-the-ground experts and the vehicle to deliver services, aid, respite, care, food, and comfort across the state. This is the triple threat of mission-driven organizations, and today we see that coming to life. The Illinois COVID-19 Response Fund will complement and support the efforts of the Illinois Department of Human Services and our sister agencies, enable us to fill the gaps. While our administration has been responsive and spry, there are places where philanthropic resources can move more quickly and more directly. Together, we can maximize and leverage our assets to provide a safety net for providers and those individuals who are experiencing crisis situations during this pandemic. I, have committed to being a transparent, eager partner to this fund so that we can be in true alignment. I thank the founders for your foresight and swift response to meeting the needs of all in our state. At this time, it's my pleasure to introduce U.S. Senator Dick Durbin.
Thank you very much. It's an honor to be here and to be part of this presentation. And I want to preface it by thanking Governor Pritzker. When you stand for office, you never know what challenge you will face if you're elected. No one could have possibly imagined the challenge which this governor and our entire team leading the state at this moment are facing each and every day. We hear these statistics, and these are human lives. And this governor has made it clear that he is addressing this challenge in the most serious possible manner with professionalism, determination, and compassion. He's put together an excellent team. I want to thank Dr. KSDK. It's been my pleasure to work with her in several different capacities, and Secretary Ho and others who are here. And I want to shout out as well to the big sister, Penny Pritzker, a personal friend for many years, a leader at the federal level as our Secretary of Commerce. And Governor, I couldn't think of a better person to choose than your sister to lead this effort to bring together the caring and charitable people who want to help Illinois through this crisis. So thank you all for what you have done to this point, and I stand ready to work with you moving forward. Something miraculous has happened in Washington. We've actually done something on a timely basis. Think about it. Over the past 4 weeks, we have enacted 3 major pieces of legislation. It was just 4 weeks ago that on a bipartisan basis, we said to the president that his request for $2 billion wasn't enough to face this crisis. And in a matter of days, we raised that number to $8 billion and passed it quickly. And then we realized that wasn't even close. And in a matter of days, again, we passed the second piece of legislation, which raised the amount to $100 billion, focusing on making sure that testing would be free, that people would have enough to eat in the midst of this crisis, that we would send more money back to the states to compensate them.
You have been watching a news conference with Illinois Governor J.B. Pritzker, bringing us an update on COVID-19 in that state, including news there has been 7 additional deaths in Illinois and 673 new COVID-19 cases. Governor Mike Parson is now updating Missouri on the state's COVID-19 response.
As of 2:30 p.m. today, there have been 502 positive cases of the COVID-19 in Missouri. A large number of these cases have been in the age bracket of 20 to 29-year-olds. This shows that it doesn't matter how old you are, you're still at risk, and we need everyone to take this seriously. These are tough times for our state, but we will get through this together. There are still good things happening all around us. Missourians from across the state have stepped up to help, from the private sector to everyday citizens. As Director Parson said yesterday, Missouri's public safety team remains strong and is working each day to get millions of dollars worth of PPE to our hospitals and our first responders. As we continue to address COVID-19, the transportation of PPE is critical. Motor carriers must be able to deliver essential supplies and equipment to our communities as quickly as possible. Several commercial driving regulations have been waived or relaxed, and the Missouri Department of Transportation has been a huge help in this. Our trucking industry has also stepped up to the challenges, and I want to thank all of the men and women working so hard to keep the supply chain open and the goods and services moving to our citizens. Today, Director Patrick McKenna is here with us from MoDOT to give us an update on the MoDOT issues surrounding the state. Director?
Thank you, Governor Parson. Under your leadership, we have been working diligently with our steadfast federal partners and modal agencies of the U.S. Department of Transportation, as well as partners in the motor carrier and agricultural industries to enable emergency flow of goods. We've relaxed the hours of operation for motor carriers to give them more flexibility for transporting goods. We've eased restrictions to allow for heavier than normal truckloads of emergency supplies and equipment to travel on all Missouri highways, including interstates. This includes shipments of livestock and poultry and associated feed and fuel. And we've suspended all Missouri International Registration Plan and International Fuel Tax Agreement trip and fuel permit requirements, including fees for vehicles not currently registered for interstate travel in Missouri. In addition, the Missouri Department of Revenue has implemented a 60-day extension of driving privileges. This extension applies to individuals with commercial drivers or non-commercial drivers license expiration dates of March 1, 2020 through April 30, 2020. For example, an individual with a CDL expiring March 1, 2020 will have until May 1st, 2020 to complete the required license renewal in their local license office. Second, the Revenue Department has implemented an extension of CDL medical certificates. This extension applies to individuals holding a CDL or a commercial learner's permit with a current medical certificate that has been issued for a period of 90 days or more and has an expiration date of March 1, 2020 through April 30, 2020. These individuals have been granted an extension of their medical certification until June 30, 2020. This relief will give Missouri's commercial drivers additional time to complete the required medical exam and to submit an updated medical certificate to their local license office so that their Missouri driver record can be updated. Another effort we're making is to keep interstate highway rest areas open to the traveling public and commercial motor carriers. We're also cleaning and disinfecting the rest areas on a more frequent basis. Switching gears a bit, let me outline what we're doing to keep vital transportation projects and essential state highway maintenance operations moving. At this time, we're continuing the design and construction of the state's road and bridge projects. In addition, we intend to proceed with future project bid openings, which are fully electronic, and the Missouri Highways and Transportation Commission will continue to meet monthly by video or teleconference, starting with the April 1st meeting next week. That means that vital projects made possible by the governor's focus on bridge program will continue, as will the construction projects in our 5-year transportation program for now, as we continue to work with industry through their workforce and supply chain availability. The general revenue funded cost share program project contracts for construction will not begin prior to July 1 to help with the closeout of the state's fiscal year 2020 budget. We've been in close contact with our contracting and consulting partners to assure them that payments to them will not be affected and that we'll work with them on specific issues such as workforce availability to ensure projects continue to move forward. In addition, our statewide highway maintenance operations such as pothole patching, striping, and pavement repair also continue at present, although under the guidelines issued by the Department of Health and Senior Services and the CDC for social distancing, hand washing, and so forth. We're keeping lines of communication open with the public through our website and our customer service centers. The public can still call our toll-free number, 1-888-275-6636, 24/7 to speak with a customer service representative or to get the latest road conditions or register a road concern. We're proud to be able to help, and we'll continue to look for ways we can ease the challenges facing our transportation partners at this critical time. Please remember, if you're traveling, observe speed limits, do not drive impaired, and always buckle up and put your phone down. Thank you.
Director, thank you very much. I might just want to add to Director McKenna's statement that he made there, how important it is that I've emphasized to him to make sure these trucks and this transportation for this product throughout Missouri has got to be able to run. And to the point where I know he's went somewhat toe-to-toe with the federal government on how we're going to make sure these restrictions are lifted where we can get product up and down the road. And I want to thank him for doing that, because his orders as a director is make sure we get supplies up and down this road, whatever it takes, for the people of this state. So I want to thank you, Patrick, and thank you, Director, for what you're doing. We realize this is a challenging, uncertain time for Missouri and the nation. No matter how you have been affected by COVID-19, whether you or your family member has gotten COVID-19, whether you've lost a loved one or you've lost a job, this crisis is affecting everyone. Mental health is something everyone should focus on, not just right now, but going forward as Missourians continue to cope with the after effects of COVID-19. We're going to get through this together. We have to personally take care of ourselves mentally and physically. Like all of our state departments, the Missouri Department of Mental Health has been taking steps to help with our COVID-19 response. Today, Director Mark Stringer is here today to provide an update from the Department of Mental Health. Director?
First of all, on behalf of the Department of Mental Health, I want to express my sincere sympathy to the Missouri families that have lost loved ones to this virus. Please know that you're in our thoughts and prayers. Second, I want to thank the dedicated men and women who work in our state psychiatric hospitals, habilitation centers, state-operated programs, and contracted community providers of treatment, prevention, recovery, and habilitation services. I cannot tell you how much I appreciate your commitment to serving some of the state's most vulnerable citizens, especially during a time of crisis. The Department of Mental Health serves people of all ages with its mental health services, substance use disorder services, and habilitation services. We serve about 170,000 people a year in a variety of settings that I just mentioned, which includes both institutions and community programs. In response to COVID-19, and under the leadership of Governor Parson, my department has taken a number of steps to ensure that our services continue with as little disruption as possible. For example, working with Director Todd Richardson and his great team at the Mo Health Net Division, we have relaxed or suspended some of our rules and regulations that would prevent our community providers from delivering essential services during this time. We've also made it possible for community providers to do much of their work by telephone rather than the traditional face-to-face requirement. Our service providers have dramatically ramped up their use of telehealth and telephones, and we are exploring ways to stay in touch with people who cannot afford cell phones or extra minutes. For our psychiatric hospitals and HAB centers, we've worked with other state departments like corrections, social services, and public safety to share policies and procedures that are best practices in both natural and man-made disasters. Sincere thanks to my colleagues, Director Precythe, Director Tidball, and Director Karsten. Where possible, our state employees and contracted providers are working from home in order to minimize the risk of infection. But in many cases, in our hospitals and HAB centers, for example, it's simply not possible. Again, the bravery and dedication of those professionals is truly remarkable. Finally, for the mental health of all Missourians who may be struggling to cope with this pandemic, here is an important resource. The Federal Disaster Distress Helpline was created for times like this. It is staffed with mental health professionals who can talk with you, and if you need more help than they can provide, they can connect you with services here in Missouri. Specifically, they can connect you with our Access Crisis Intervention System, or ACI. It's staffed with professionals linked to state-certified mental health and substance use disorder services. They are there to help you, and the ACI system is free and completely confidential. So the Disaster Distress Helpline has a website which is easily found with a search engine like Google, or you can call 800-985-5990. Again, that number is 800-985-5990. Thank you.
Thank you, Mark. One thing I just want to mention, every day these department officials that are in here speaking to you is talking about things they're doing to help the everyday people out there, whether it has to do with daycare, whether it has to do with transportation, whether it has to do with mental health, from all aspects of government. What we're doing every day is basically, as of today, we've deregulated over 158 regulation, rules, and laws to make sure we're providing a service to the people of this state without the normal procedures of delay or going through the bureaucracy, and we will continue to do that. And you see this every day in our society of what we're doing to try to make things better from the governor's office and trying to make sure that all these department heads are working hard every day to make sure that we're making it as easy as we can and taking care of the people of this state. So with that, Kelly, we got some questions today.
We do. These are from some media inquiries that have given to us. The first one is Jennifer Moore from KSMU Ozark Public Radio. She asked, currently it is DHSS protocol that even in nursing homes and assisted living facilities where there is an outbreak of COVID-19, only those residents with symptoms are able to be tested. DHSS has confirmed this is due to a scarce amount of testing. My question to Governor Parson is, given the way the coronavirus spreads through nursing homes in Washington state, would you be willing to change that protocol so that every single resident in the coronavirus confirmed long-term care facility can get a priority test?
I would be willing to change that if it was possible to do. But I know every day there's a shortage of the test kits that are out there, and we have to allocate which ones we think are a priority for our state. As much as I would help everyone that could be able to be tested today that wants to be tested, the reality of it is we don't have the test. They don't have it nationally. So we have to prioritize who we're going to test and who we're not. Unfortunately, we have to make decisions that the medical personnel has to make decisions on that. I got to trust that medical staff, those doctors, to do that job every day. But I also have to be able to test those frontline people, whether it's the doctors, whether it's the nurses, whether it's people in the emergency room that actually are dealing with us on a daily basis. And it's unfortunate, but every day that gets to be a little bit better, but it continues to be a problem nationwide, not just here in Missouri.
Okay, this question is also for you, Governor Parson. This one is from Sebastian Martinez Valadivia from KBI Columbia. Is the governor designating specific resources for rural areas that lack ICU beds?
Today, as we speak, when it comes to the bed space in the state of Missouri, we have a plan in place. Director Richardson is working on that for us. They were out at SEMA this morning, the staff was, working with the Corps of Engineers, working with the National Guard, with a lot of different people. But we're finding sites all over the state of Missouri that we can convert into medical facilities or hospital beds, whether in rural Missouri or urban Missouri. Again, with the data you see every day here at the governor's office, you have to allocate your resources where they best fit for that time and where we know those severe problems are. So every day we make plans for that. We always take in, whether it's urban or whether it's rural, to have a plan in place for the next few days or for the next months. But we're planning that every day here at the governor's office.
All right, this one is for you also, Governor Parson. Jack Suntrup from the St. Louis Post-Dispatch. There seems to be a large demand for a statewide stay-at-home order. Today, have you changed your mind on that?
You know, I have not. I answered that question yesterday, but I think it's important. We look at that every day. We look at it from a factual basis, statistic-wise, where these cases are and at what point we would make that decision if we did. But, you know, every day I got to keep in mind, I've got to do the whole state. And the other thing I think you keep in mind, the mayors are doing their job out there too. They've already got a lot of orders in the urban areas where it's the most cases are. But again, I've got to evaluate that, whether I shut down the entire state with that order or not. I still think the most important thing you can do, and I think when it really gets down to all the red tape that we go through, it's a matter of staying home if you don't have to be out. No more than groups of 10, and staying 6 feet away, the social distancing. Those are the keys to fight this virus.
Okay, this next question is for Dr. Williams. This is from Jason Hancock, the Kansas City Star. More than half of Missouri positive COVID-19 tests have come from the private lab. Because those labs report only positive tests, the state does not have an accurate count of how many residents have been tested for the virus and what proportion of those tests were positive. So, Dr. Williams, does this cause you concern in the state's ability to track this outbreak? And have there been any steps being taken to change this process?
Again, I'm Randall Williams, Director of Health and Senior Services, and thank you very much for the question. We do track negatives. We changed our regulations so that we know that we've done more than 6,000 tests here in Missouri. Our numbers are reflecting national. Our state lab is about 8% positive. For our commercial, it looks to be about 6 to 8% positive. The good news is that for those 92 to 94 out of 100 people that are testing negative who are symptomatic. When we look at our data reporting compared to other states, I think people have recognized that we try to be incredibly transparent. We put on our website, like other states aren't doing, the location, the age, and we're using that data epidemiologically to try to model where we're seeing clusters. I think the governor started out very correctly saying if you look at our data, it's 20 and 30-year-olds that appear to be people who are testing positive. And so I think our message has been very, very consistent that while they may not have the morbidity, what we're learning is that they certainly may be propelling the infections. And so we just want to reiterate one more time that social distancing, even among 20 and 30-year-olds, is so incredibly important to get it from getting into our nursing homes. We'll just address that real quickly, is that I just got off the phone with a clinician. Our new guidelines on Monday are designed to give clinicians more discretion, and they very much have appreciated that in talking with them since then. So that at any time, what we've tried to do is to loosen our criteria so if there is a situation like that, that they have the discretion to do the test. The incubation period, again, is 5 days, and people are most symptomatic when they're infectious. So when they're coughing at 5 days is when those tests are most likely to be positive. But again, we're happy to share any of that data with you. We think that, as the governor has said, that we understand people are very anxious, and we think one great way to help people is to give them as much information as we possibly can. Thank you.
Thank you, Dr. Williams. Earlier today, I spoke with the White House, with the president and the vice president and other governors around the state of Missouri. And going back to the question that was just asked, you know, every governor in the United States is struggling to get this equipment. You've got the industrial might of the United States on 24 hours, 7 days a week trying to provide these products. And every day this is an issue with all of us. We're all trying to figure out how we can get more of those supplies. And again, I want to stress what I said yesterday. There's so many people in the state of Missouri that's stepping up, that they are literally stepping up, trying to figure out how they can help, whether they can make the PPE, the garments for emergency personnel, whether we can make the masks, whether we can figure out other alternatives to testing. Everybody's trying that every day across the United States. And right now, the reality of it is some of these areas like New York is getting a lot of supply and a lot of resources going their way, and understandably so. But it's still frustrating when you're the governor of the state of Missouri and you're fighting that battle every day. But we're going to continue to fight for the people of this state. But it is going to be an ongoing battle in the days to come. So let me just say this every day, and I'm going to continue to say it every time I get up here in front of the Missourians. Social distancing is the most important step you can take to stop the spread of COVID-19. Whether you live in an urban area or a rural area, stay home as much as possible. This is just not about you. This is about everyone around you and the entire state of Missouri. We will continue to overcome this, but it's going to take all Missourians working together, looking out for each other, and following social distance orders. It is the most important thing we can do, is to stay at home when you can stay at home, enforce the social distancing rules on yourself. Don't wait for government to do it. You take it upon yourself as citizens of this state. If we will do that, and we'll make sure and our families do that, and our friends do that, and the people that were in our communities will do that, we will get ahead of this virus. But it's going to take a while, but we have to start now, abiding by these rules and orders. Thank you very much for today. Thank you.
You have been watching a news conference with Missouri Governor Mike Parson. The state reported that COVID-19 cases rose by 146 Thursday, a single-day high, and the second day in a row of more than 100 new cases in Missouri. We have much more in the KSDK app, KSDK.com, and all the latest on COVID-19 and the response at 4, 5, 6, and 10. We return you to regular programming.